Hi there, superstars. Are you a COVID long hauler? That is a mouthful, but that's the term being used to describe people that get COVID, but then even after COVID is technically gone, are still having some long-term effects. And those effects include things like just being tired all the time, having headaches, not being able to take that full breath in and just feeling constricted. Well, here's what's happening. We do know that there are a set of patients who have had COVID that go into this long-haul syndrome, so to speak, and I've seen some of them in practice. Here is where I think we really need to focus. And again, some of the research is, as always, evolving and changing and shifting, but where I think we really need to focus is on what we can do. And what's happening is that COVID, like so many other viruses, we sometimes have this discussion when we talk about Epstein-Barr or mycoplasma or even the flu, for example, but they can go from being acute infections, or meaning infections that you're dealing with at the present moment, to becoming chronic or just triggering an autoimmune-like flare. And that's what we are seeing with COVID long haul, where it's almost like this chronic inflammatory response in the body, and the body simply cannot heal. It can last for as long as 6 months. Super frustrating for people who just want to get back to their regular lives and do the things you want to do. I know I had one patient who was like, I just want to get back in the gym again, but every time I do, I feel like I'm set back. So here's my advice. You have to be super patient with yourself. You have to over-nurture yourself, and that's where some of these principles that we've been talking about over the last 9 months or so become so important. The quality of the food you're eating, really watching for inflammation, all the different signs and symptoms of inflammation, upping your intake of key nutrients like vitamin D and C and zinc, adding in anti-inflammatories like turmeric and the omega-3 fats, putting all of this together, and then resting. And I think that's really what it takes to get over this COVID long haul. And this is a scenario too where you might want to be thinking about IV therapy, IV vitamin therapy, to sort of, again, over-nutrient, overhydrate, overdo it with how much you're taking care of yourself for a little bit so the body can effectively heal. So COVID long haul syndrome is real. It is affecting a certain percentage of folks that get actual COVID symptoms. You can prevent it by, on the front end, taking care of that immune system and managing inflammation, and on the back end, understanding what's happening and really fighting for your health by doing the right things for you and not powering through, just trying to power up. Hope you guys all stay healthy and well. A lot of headlines, again, we'll talk about them, but stay healthy, stay well, stay super powered, and I will see you